please.
This conference is being recorded.
Good morning, everybody. Welcome to this technical briefing on vaccines. We have three speakers, two with opening statements. The first one will be Dr. Theresa Tam, Chief Public Health Officer, then Dr. Howard New, Deputy Chief Public Health Officer, and we will also have Dr. Matthew Tunis, Executive Director for the NACI Secretariat, who will be answering questions. So this is all going on virtually, and we'll start with Dr. Tam.
Merci, and bonjour à toutes et à tous.
Thank you, and good morning to
Nationally,
everyone.
the daily case counts continue to increase, but there is still considerable regional variation in disease activity. Over the most recent 7-day period, an average of over 2,800 new cases were reported daily across Canada. Currently, severe illness trends have leveled off, but are still elevated and could begin to rise again unless we keep infection rates down. Over the past week, on average, 1,540 people with COVID-19 were being treated in our hospitals each day, including 465 in intensive care, and 19 deaths were reported daily. The emergence and spread of the Omicron variant of concern, including 11 recent detections in travelers coming into Canada and or their close contacts, is yet another reminder of how quickly things can shift in this pandemic unless we continue to reduce the spread and impact of the virus with vaccination and other layers of protection. In addition to strengthening diagnostics, therapeutics, infection prevention control, vaccine uptake, and other response aspects, experts on Canada's National Advisory Committee on Immunization, or NACI, have continued to update guidance to help strengthen our COVID-19 vaccination programs. Today, NACI updated advice on COVID-19 mRNA vaccine booster doses, as well as recommendations on the use of mRNA COVID-19 vaccines in adolescents and young adults. NACI recommends, and health authorities in Canada agree, that immunization in those who are eligible but have yet to receive their primary series should continue to remain the top priority in Canada and around the world. NACI has reaffirmed that the benefits of receiving an mRNA COVID-19 vaccine continues to outweigh any potential risk of experiencing rare side effects following immunization with an mRNA vaccine, including the rare risk of vaccine-associated myocarditis and/or pericarditis, most often seen in males aged 12 to 29 years. Regarding boosters, NACI considered emerging evidence on waning protection of vaccines over time and the safety and potential benefits of mRNA vaccine booster doses. In the context of the Delta variant, evidence suggests that vaccine effectiveness against infection and symptomatic disease decreases with time, and possibly against severe illness as well, especially in older individuals. No additional safety concerns were noted following mRNA vaccine booster doses. The rare risk of myocarditis and/or pericarditis appears to be lower after the booster dose than after the second dose of the primary series, though is higher than after the first dose. Based on this, NACI has increased the strength of their recommendations to now say a booster dose of an authorized mRNA COVID-19 vaccine should be offered 6 months or more after completion of a primary COVID-19 vaccine series to people aged 50 years or older. Adults living in seniors' long-term care or other congregate living settings that provide care for seniors. People who received an exclusively viral vector COVID-19 vaccine series consisting of only AstraZeneca Covishield and or the Janssen COVID-19 vaccine. Adults in and from First Nations, Inuit, and Métis communities, as well as frontline healthcare workers having direct, close physical contact with patients. NACI further recommends that a booster dose of an authorized mRNA vaccine may be offered 6 months or more after completion of a primary COVID-19 vaccine series to adults aged 18 to 49 years, with consideration of jurisdictional and individual risks. Finally, with respect to vaccination of adolescents and young adults, NACI considered new Canadian and international data that suggests the rare risk of myocarditis after receiving an mRNA COVID-19 vaccine may be lower with Pfizer BioNTech Comirnaty 30 microgram vaccine as compared to the Moderna Spikevax 100 microgram vaccine. These data also show that a longer interval between the first and second dose in the primary vaccination series results in a stronger immune response and higher vaccine effectiveness, and that longer intervals may also be associated with a lower risk of myocarditis and/or pericarditis. Accordingly, for adolescents and young adults aged 12 to 29 years, NACI now recommends that the use of Pfizer BioNTech Comirnaty vaccine is preferred over the use of Moderna Spikevax vaccine to start or complete a primary vaccine series. NACI further recommends that the second dose of a primary mRNA COVID-19 vaccine series should be provided 8 weeks after the first dose. Now and during the winter months, while the virus continues to circulate worldwide, and the significance and impact of the Omicron variant of concern is being assessed, the need for heightened vigilance remains. Regardless of which variant is circulating, we are better protected individually and collectively when we all do our best to maintain layers of protection by completing the COVID-19 primary vaccine series and getting a booster shot dose as recommended, wearing a quality, snug-fitting mask, avoid crowding, and taking other measures as possible. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous. À l'échelle
Good morning
nationale, le
to
nombre de
everyone.
cas quotidiens continue
Nationally, daily
d'augmenter,
case
mais il
counts
existe
continue
encore
to increase, but
d'importantes
there's still
variations
considerable
régionales
regional
relativement
variation
à
in
l'activité de la
disease
maladie.
activity.
Au cours des 7
Over
derniers
the
jours,
most
plus de
recent 7-day
2800
period,
nouveaux cas ont
an
été
average of
signalés en
over
moyenne chaque
2,800
jour
new
au Canada.
cases were
À l'heure
reported
actuelle, les
daily
tendances des
across
cas de
Canada.
maladies graves
Currently,
se sont
severe
stabilisées,
illness
mais sont
trends have
toujours
leveled off,
élevées
but are
et
still
pourraient être à
elevated
nouveau à la
and
hausse
could begin to
si nous ne
rise
parvenons
again
pas à maintenir les
unless
taux
we can
d'infection
keep
à un
infection
faible
rates
niveau.
down.
Au cours de la semaine dernière,
Over
en
the
moyenne,
past week,
1540
on average,
personnes atteintes de la COVID-19 étaient
1,540
traitées dans
people
nos
with
hôpitaux chaque
COVID-19
jour,
were being
y
treated in
compris
our hospitals each
465
day,
personnes aux
including
soins intensifs et 19
465
décès ont
in
été
intensive
signalés
care,
quotidiennement.
and 19
L'émergence
deaths
et la
were
propagation
reported
du
daily.
variant préoccupant
The
Omicron,
emergence and spread
y
of the
compris les 11
Omicron
détections récentes parmi
variant
les
of
voyageurs
concern,
qui arrivent
including
au
11
Canada
recent
ou leurs
detections in
contacts
travelers
étroits,
coming into
nous
Canada
rappelle à quel
and
point
or
la
their close
situation peut
contacts
changer rapidement
is yet
pendant
another
cette pandémie.
reminder of how
À moins que
quickly
nous
things can
continuions
shift in
de
this
réduire la
pandemic
propagation et les
unless we continue to
répercussions du
reduce the
virus
spread
grâce à
and
la
impact of the
vaccination et à
virus with
d'autres mesures de
vaccination and
protection.
other layers
En plus
of
d'améliorer les
protection.
méthodes
In
diagnostiques,
addition to
les approches
strengthening
thérapeutiques, la
diagnostics,
prévention des
therapeutics,
infections,
infection
la
prevention
lutte
and
contre les
control,
infections, les
vaccine
taux de
uptake,
vaccination
and
et les
other
autres aspects
response
d'intervention,
aspects,
les experts du Comité
experts
consultatif
on
national
Canada's
de
National
l'immunisation, ou
Advisory
CCNI,
Committee on
ont continué
Immunization,
de
or
mettre à
NACI,
jour des
have
orientations
continued
pour
to update
renforcer nos
guidance to
programmes de
help strengthen
vaccination
our
contre la
COVID-19
COVID-19.
vaccination
Plus tôt
programs.
aujourd'hui, le CCNI a modifié ses conseils
Earlier
sur les
today,
doses de
NACI
rappel du
updated
vaccin
advice on
à
COVID-19
ARNM contre la
mRNA vaccine
COVID-19
booster
et des
doses,
recommandations sur
as well as
l'utilisation
recommendations
des
on the
vaccins
use of
à ARNM
mRNA
contre la COVID-19
COVID-19
chez les
vaccines in
adolescents et les jeunes
adolescents and
adultes.
young adults.
Le Comité consultatif national de l'immunisation recommande et
NACI
les autorités de la
recommends
santé
and health
publique au
authorities in
Canada
Canada
conviennent
agree
que la vaccination des
that
personnes
immunization in
admissibles,
those
mais qui
who
n'ont pas
are
encore reçu leur
eligible
série
but
primaire
have
des
yet to
vaccins
receive their
doit
primary
continuer de rester
series
la priorité
should
absolue
continue to
au
remain
Canada
the
et dans
top
le monde.
priority in
Le
Canada and
CCNE
around the
a
world.
réitéré que les avantages du
NACI has
vaccin
reaffirmed that the
RNM
benefits of
contre la
receiving an
COVID-19
mRNA
continuent de
COVID-19
l'emporter sur les
vaccine
risques d'effets
continue to
secondaires
outweigh
rares
any
qui peuvent
potential
survenir
risks
après
of
la vaccination
experiencing rare
par un
side
vaccin
effects
RNM,
following
y
vaccination
compris
with
le
an
faible risque
mRNA
de
vaccine,
myocardite et de
including the rare
péricardite
risk
après
of
l'administration du
vaccine-associated
vaccin qui touche
myocarditis and
principalement
or
les
pericarditis,
adolescents
most
et les jeunes
often seen in
adultes de sexe
males
masculin
aged
âgés de 12 à
12
29 ans.
to 29
En ce qui
years.
concerne les vaccins de rappel,
Regarding
le Comité
boosters,
consultatif national de l'immunisation a
the
tenu
National
compte des
Advisory
nouvelles données
Committee on
probantes sur le
Immunization
déclin de la
considered
protection
emerging
des vaccins
evidence
au
on
fil du
waning
temps et
protection
sur
of vaccines
l'innocuité
over
et
time
les
and the
avantages
safety
possibles
and
des doses de
potential
rappel du
benefits
vaccin
of
ARNM.
mRNA vaccine
Dans le
booster
contexte du variant
doses.
Delta,
In the
les données
context of the
probantes
Delta variant,
laissent entendre que
evidence
l'efficacité des
suggests
vaccins
that
contre les infections
vaccine
et les maladies
effectiveness against
symptomatiques diminuent
infection and
avec le temps
symptomatic
et
disease
que l'efficacité des
decreases with
vaccins
time
contre les maladies
and
graves
possibly
diminue
against severe
probablement
illness
aussi,
as well,
surtout chez les
especially in
personnes
older
âgées. Aucune
individuals.
autre préoccupation
No additional
supplémentaire
safety
relative
concerns
à
were noted
l'innocuité n'a été
following
soulevée à la suite des doses de rappel du vaccin
mRNA vaccine
ARNM.
booster doses.
Le rare risque de
The rare
myocardite
risk
ou des
of
péricardites semble plus
myocarditis
faible après la dose de
or
rappel qu'après la
pericarditis
deuxième dose de
appears
la
to be
série
lower after the booster
primaire.
dose than
Toutefois,
after the
ce
second
risque est
dose of the
plus élevé
primary
qu'après la
series,
première dose.
though is higher
Selon
than
ces
after the first
renseignements,
dose.
le Comité
Based on this,
consultatif
the
national de
National
l'immunisation
Advisory
a
Committee on
augmenté la force de
Immunization
ses
has
recommandations.
increased the
Il est
strength of
maintenant
their
indiqué
recommendations
qu'une
to
dose de
now
rappel
say
d'un vaccin
the booster dose of an
ARNM
authorized
autorisé
mRNA
contre la
COVID-19
COVID-19
vaccine
devrait être
should
offerte
be
6 mois ou
offered
plus
6
après
months
avoir
or
reçu une
more
série primaire de
after
vaccins
completion
contre
of
la
a
COVID-19
primary
aux
COVID-19
populations
vaccine
suivantes.
series 2,
Les personnes de 50 ans et plus,
people aged
les
50
adultes
years
vivant
or
dans des
older,
établissements qui
adults
offrent des
living
soins
in
de longue durée
seniors'
aux
long-term
aînés
care
ou
or
dans
other
d'autres milieux de vie
congregate
collective
living
avec soins aux
settings
aînés,
that
les
provide care for
personnes qui ont reçu
seniors,
exclusivement
people who
une
receive
série
an
de vaccins à
exclusively
vecteurs viraux
viral vector
contre la
COVID-19
COVID-19,
vaccine
ce qui
series
comprend seulement le vaccin
consisting of only
d'AstraZeneca, Covishield
AstraZeneca,
et le vaccin de
Covishield,
Janssen.
and or
Les
the
adultes qui
Janssen
vivent dans les
COVID-19
communautés,
vaccine,
dans
adults
une
in
communauté
or
des Premières
from
Nations,
First
des
Nations,
Inuits ou des
Inuit
Métis
and
qui en sont
Métis
issus de ces
communities,
communautés et les travailleurs de la
and
santé
frontline
de
healthcare
première ligne
workers
ayant un
having
contact
direct,
physique
close
direct
physical
avec les
contact
patients.
with patients.
Le Comité consultatif
The
national
National
de
Advisory
l'immunisation
Committee on
recommande en
Immunization
outre
further
qu'une dose
recommends
de rappel d'un
that a
vaccin
booster dose
ARNM
of an authorized
contre la COVID-19
mRNA
puisse être
COVID-19
ouverte aux
vaccine
adultes de
may
18
be
à
offered 6 months or more
49 ans,
after
6 mois ou
completion
plus après la réception d'une série
of a
primaire de vaccins
primary
contre la COVID-19.
COVID-19 series
Il faut tenir compte
to
des risques
adults
individuels
aged
et
18
des
to
risques des
49 with consideration
administrations.
of jurisdictional
Enfin,
and
en ce qui
individual
concerne la
risks.
vaccination des
Finally,
adolescents
with
et des
respect to
jeunes adultes,
vaccination of
le Comité
adolescents and young
consultatif
adults,
national de
the
l'immunisation
National
a
Advisory
pris en
Committee
compte les
on
nouvelles données
Immunization
canadiennes
considered
et
new Canadian
internationales
and
qui laissent
international
entendre
data
que le rare
that
risque de
suggests
myocardite
the rare
après
risk
avoir
of
reçu un vaccin
myocarditis after
RNM
receiving
contre la
an
COVID-19
mRNA
peut être
COVID-19
plus bas
vaccine
avec le vaccin
may be lower
Comirnaty de
with the
Pfizer-BioNTech
Pfizer-BioNTech's
30 microgrammes
Comirnaty 30
qu'avec le vaccin
microgram
Spikevax de
vaccine
Moderna
as
100
compared to the
microgrammes.
Moderna
Ces données
Spikevax
indiquent
100
également qu'un
microgram
intervalle
vaccine.
plus long
These
que ce
data
qui a
also
été
show that a
recommandé
longer
auparavant
interval
entre la
between the
première
first and
et
second
la
dose
deuxième dose
in the
de la série
primary
primaire des vaccins
vaccination
peut
series
entraîner une réponse
results in
immunitaire
stronger
forte et
immune
une
response
efficacité
and higher
accrue des
vaccine
vaccins, et que cet
effectiveness,
intervalle plus long
and that
qu'auparavant
longer
peut également
intervals
être
may
associé
also be
à un risque
associated
réduit
with
de
a lower
myocardite
risk
ou de
of
péricardite. Par
myocarditis
conséquent,
and or
pour les adolescents et les
pericarditis.
jeunes adultes de
Accordingly,
12 à 29
for
ans,
adolescents
le
and young
Comité
adults
consultatif
aged
national
12
de
to
l'immunisation
29 years,
recommande
NACI
maintenant
now
d'utiliser
recommends
le vaccin
that the
Comirnaty
use
de
of
Pfizer-BioNTech plutôt que le
Pfizer-BioNTech
vaccin Spikevax de Moderna
Comirnaty
pour
vaccine
la
is
série
preferred
primaire de
over the
vaccins.
use of
Le
the
Comité
Moderna
consultatif national de
Spikevax
l'immunisation
vaccine to start a
recommande
complete
également que la
primary
deuxième dose de
vaccine
la série
series.
primaire de vaccins
NACI further recommends that the second
ARNM
dose of
contre
a
le
primary
COVID-19 soit
mRNA
administrée
COVID-19
8 semaines
vaccine
après la
series
première
should
dose.
be provided 8
Maintenant,
weeks
et
after the
pendant les
first
mois
dose.
d'hiver, alors que
Now
le
and
virus
during the winter
continue de
months,
circuler
while
dans le monde
virus
et que
continues to
l'importance
circulate
et les
worldwide,
répercussions du
and the
variant
significance and
préoccupant Omicron
impact of the
sont
Omicron
évalués,
variant
il
of
faut
concern
encore
is
faire
being
preuve
assessed.
d'une vigilance accrue.
The need for heightened
Quel que soit
vigilance
le variant
remains,
qui circule, notre
regardless of
protection
which variant is
individuelle et
circulating. We
collective
are better
est
protected
accrue lorsque
individually
nous
and
faisons
collectively
tout en
when
notre
we all do
pouvoir
our
pour
best
conserver des
to
mesures de
maintain
protection.
layers of
Par
protection by
exemple,
completing
recevoir la série vaccinale
the
primaire contre la
COVID-19
COVID-19
primary
et une dose de
vaccine
rappel
series
si
and
recommandé,
getting a booster
porter un
dose
masque de
as
qualité
recommended,
qui épouse
wearing
les
a
formes de notre
quality
visage,
snug-fitting
éviter les
mask,
foules et
avoiding
prendre d'autres mesures si
crowds and
possible.
taking other
Merci.
measures as
Thank you.
possible.
Make
Thank
rich.
you.
Merci beaucoup. On peut maintenant
Thank you
passer à
very
la
much.
période
We
de
will
questions
now
au
move
téléphone.
to
Opérateur,
questions
c'est à
on the
vous.
phone. Operator, over to you.
Thank you. Merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. La première question de Raymond Fillon, TVA. La parole est à vous.
Raymond Fillon, TVA.
Oui, bonjour.
over to you.
Dr. New,
Good
à quel
morning.
point le variant Omicron rend nécessaire
New,
la dose de
at
rappel? En
one
d'autres
point,
mots, est-ce
is
que c'est ce variant qui
Omicron,
vous pousse aujourd'hui à
a
recommander
reason
une
to
dose
get
à
a
tous les
booster
adultes?
shot? Is this why you're asking all
Non,
adults to
non,
get
pas
the
du
booster
tout.
shot?
Le variant préoccupant Omicron, on est en
Not at
train
all. The
encore
Omicron
d'étudier
variant is
qu'est-ce
still
c'est
being
quoi
studied.
les implications,
We are
parce qu'il y a
trying to
toujours les
understand
trois grandes
its
questions
implications because there
pour
are three
n'importe
big
quel variant
questions
préoccupant. Est-ce que
which
c'est plus
apply to any
transmissible?
variant of
Est-ce que
concern. One, is it more
est-ce que
transmissible? Two,
ça donne une maladie plus grave? Aussi,
does
c'est
it
quoi
lead to
les
more
implications pour
serious
les vaccins?
illness?
Mais à
And
date,
what
on n'a
are
pas des réponses. Les
implications
scientifiques à
regarding
travers le monde
vaccines? We don't
continuent
have the answers to those
avec le
questions, and
travail
scientists around the world
pour
are
avoir des
continuing the
réponses aux
work
questions.
to
Mais pour
answer those
l'instant, ce
questions.
qu'on
But
voit
for
au
now,
Canada,
what we're
le
seeing in
variant
Canada
Delta, c'est
is
ça,
that the Delta
le variant
variant
qui est dominant
is the dominant
avec les virus qui se propagent, qui circulent au
virus
Canada.
which is
Et on voit aussi
circulating
que
in this country.
notre effort
We
avec la
also
vaccination au
see
Canada,
that
c'est
the
bien. On
vaccination
a bien
effort in
fait.
Canada is
La
going well.
couverture
Canada
vaccinale
has done
est
well.
pas mal haut,
Vaccine
mais on peut
coverage is
toujours
quite high,
avoir comme on dit, un niveau
but
plus haut. Et
we
c'est
can do
très
better.
important de continuer avec
So
nos
it's
efforts de
important to
vaccination.
continue with
Ce
the
qu'on voit maintenant
vaccination.
avec les
What
données
we're now
probantes, c'est
seeing
que
with the
on voit
evidence,
peut-être les premières indications que peut-être la
we're getting
protection à
the
l'échelle de la
first
population
indications that
commence peut-être à diminuer. Et
vaccine
peut-être
protection
plus pour
may
les
be
aînés, les
waning,
personnes qui ont reçu
perhaps more in
le série
seniors
primaire du vaccin,
and those who have
peut-être au
received
début
the
de
primary series
2020,
of the vaccine at the
comparé
beginning of
à les autres
2020,
groupes
as
d'âge,
opposed to
les
other
autres
age groups
sous-populations peut-être qui ont reçu leur vaccin
which
plus
got their
tard. Donc,
vaccines a bit
c'est très
later.
important maintenant
So
parce qu'avec l'hiver,
it's
on
important
commence
because with
aussi avec
winter
les
looming,
rassemblements à l'intérieur.
people will start to
C'est
gather
aussi
indoors.
très important de
So
souligner
it's
toutes les autres
important
mesures de
to
santé
point out
publique
that we should also still
pour
be
donner
taking
des
the
autres couches de
other
protection, mais
protection measures.
le travail avec l'examination,
That
analyse
said,
des
the
données
study
probantes
and analysis
concernant
of
les doses de
the
rappel,
data
c'est
on
déjà
boosters
fait, déjà même avant
has started,
comme
is
l'apparition
ongoing,
de variants Omicron. C'est pas à
and that
cause
work
de
was even
variants, mais
happening before
c'est
Omicron
n'importe quel
appeared
variant.
on
On
the
continue
scene.
avec notre programme vaccinal et c'est très
Regardless of what
important de continuer
variants
avec nos
emerge,
efforts.
we
Avec
continue
la
with
vaccination,
our work, with
maintenant
our
avec les doses de
study.
rappel, mais aussi continuer
And
avec les autres
that
mesures de
work
santé
will
publique.
continue
Merci.
despite the advice on booster shots now.
Merci. Certains
Thank you.
disent par ailleurs que les intervalles plus longs
However,
entre
some people are saying
l'administration
that
des
a
deux premières doses, ça
longer
fait en sorte que la
time
dose de
span
rappel est peut-être
between
pas
the booster
nécessaire
shot
après 6
and the
mois,
second
qu'on
shot
devrait peut-être attendre plus longtemps. Vous en pensez
shouldn't
quoi?
happen after 6 months, but later.
Merci pour la question.
What
C'est
do
une
you
bonne
think of that?
question. Ce qu'on voit avec
Thank you for the
les
question.
autres
It's a
pays,
good
c'est
question, and
toujours
we're seeing
important
this
de
in
aussi
other
regarder
countries,
l'expérience,
so
les
it's really
expériences dans
important
les
to
autres
see
pays.
what is
On
happening
voit que dans les pays
elsewhere.
comme
So
Israël,
in
les
countries
États-Unis,
like
qui ont
Israel
utilisé
and in the
les
United
vaccins avec
States, which
un intervalle entre les doses peut-être plus
applied
courte
a
selon le
shorter interval
fabricant,
between the
que
first and
leur
second doses, depending on
protection
the
limitée à l'échelle de la population
manufacturer of the vaccine and the
ont diminué
population
plus
groups.
rapidement.
We've seen
Ici au
that the
Canada, on
effectiveness has
a
gone
comme dit,
down when the first
l'avantage,
and two shots were closer together.
on les
And the advantage
bénéfices
here in Canada
d'avoir eu
is
en
that
général
we
pour
were able
beaucoup de personnes un intervalle à
to
plus
learn
long.
from other
Donc, je
countries'
pense
experiences.
qu'on a
So we
encore à
decided
l'échelle de la
to
population générale
increase
bien
the time
protégée
span between the
contre
first and second doses, so Canadians are
la
well
maladie grave,
protected
mais on a les
against serious illness.
premières indications que peut-être que
The first indications are emerging
commence
that
à diminuer. Donc, je
protection
pense que
is
c'est le
beginning to
moment,
wane.
un bon
So
moment
we believe this is the right
pour avoir
time
un programme avec de vaccination avec des
to
doses de rappel, parce que
have
avec les données
booster
probantes,
shots
on voit voit qu'avec une dose rappel,
Again,
ça peut
looking at the
renforcer
data,
la
we've
protection
seen that the
immunitaire
booster
aussi,
shots
aussi
can
la
improve
durabilité. Et
immunity
c'est pourquoi
and
on
increase the
recommande maintenant
longevity of
une
the
dose rappel.
effectiveness of the
Et
vaccine, which is why
c'est
we're
quelque chose à suivre
recommending
parce qu'on ne
booster
va pas
shots.
attendre trop
We
longtemps.
don't
Si
want
on
to
attend
wait
vraiment pas
too long.
les données tardives qui indiquent, ah oui, le taux d'hospitalisation, les décès augmentent, c'est déjà trop tard parce que si même on commence avec un programme de vaccination, ça prend moins de 2 semaines après quelqu'un qui reçoit un vaccin d'avoir une protection. Donc, je pense que c'est le bon moment maintenant, avant les fêtes, avant que tout le monde rentre à l'intérieur, de lancer, comme on dit, un programme de vaccination, incluant une dose de rappel pour les populations prioritaires. Merci.
For priority groups. Thank you.
Opérateur, prochaine question.
Next question, operator.
Thank you, merci. The next question is from Mackenzie Gray from CTV News. Please go ahead.
Hi, doctors. I'm just looking to get some clarity on why the recommendation is for people 50 and up, they should get a vaccine, but for people 50 and under, it's discretionary for a NACI recommendation. I think it's pretty clear from the language in the report, and Dr. New, from what you said earlier, that it seems like it's only a matter of time for adults who are below 50 that they're going to get a vaccine. Why not get ahead of it now and recommend and open up eligibility to everyone at this point in time?
Yeah, thank you for that question, and I'll take it first. So I think our primary focus and that of the NACI recommendation is still to strongly recommend it for the groups, not only because they were at higher risk potentially for serious outcomes, but that they were immunized earlier. So the recommendation is that the booster dose should be offered 6 months or more after completion of a primary series. So both the duration of when someone has received that vaccine, as well as whether they're at higher risk of serious outcomes, are taken into account. So NACI also strengthens their recommendation over time as well as more data becomes available. As Dr. New had said in French, the data that we have at the moment shows that the vaccines are holding up pretty good against severe outcomes. We're most concerned about severe outcomes in those who are elderly or have other higher risk conditions that we talked about. There is certainly a direction of travel in terms of the waning of the vaccine effectiveness over time against asymptomatic infection and any symptoms. So that's why I think the recommendation is stratified. And for the younger people, they probably haven't reached that 6-month mark as yet.
I'd like to ask about comments of the Moderna. Sorry, go ahead.
Sorry, just one more point to add in addition to Dr. Tam's comments. Something else that was discussed by the committee was the fact that in those 50 and older, they do have increased rates of underlying medical conditions as well, which is part of what's grouped them together. Thanks.
The Moderna CEO has said that vaccines may be less effective against the new Omicron variant. But what would you say to Canadians who would say, you know what, I'm going to wait on getting the original formula of the booster now and wait for a potentially new formula that could come out within a few months?
Yeah, thank you for that question. So at this current moment, Delta variant is the most dominant variant. It's like 99.8% of what we have in Canada. And so we have to mitigate the risk of this present threat. So I think the primary focus, I think as Dr. New has said, is that the NACI recommendations were going to come out anyways this week, Omicron or not, to recommend the booster dose, as we've just described, to persons over the age of 18 to adults. And so I think the extent of the protection against Omicron from the primary series and booster dose remains to be seen. And we're going to learn a lot about this in the days to come. But nevertheless, it is still prudent to maximize the possibility of protection from vaccine by, first of all, offering the vaccine to anyone who hasn't had the primary series, but then offering the boosters as we've just laid out.
Merci.
And the Omicron variant specific vaccines are going to take months. But right now, we have the potential for a Delta surge.
Opérateur, prochaine question.
Operator, next
La prochaine question de Catherine Lévesque, la presse canadienne. La parole est à vous.
Press. Over to you.
Oui, bonjour au docteur. Je voulais
morning,
revenir un peu sur la
doctors. I'd like
question
to come
de mon
back
collègue Mackenzie. Donc,
the
si je
question
comprends
asked
bien, parce que la
by my
semaine
colleague
dernière, il y a le ministre
Mackenzie,
fédéral de la
last
Santé
week,
qui semblait
the
dire
federal
qu'il
health
demandait aux
minister
spécialistes de
seemed to
statuer sur
say
les doses de
that he would
rappel
ask
en raison
NACI
d'Omicron. Mais si je comprends bien, là, ça n'a
about
rien à voir. Là, ça
booster
allait
doses
sortir
because of
cette
Omicron,
semaine, Omicron
but
ou non?
it seems that there was no connection.
Oui, donc, c'est pas la première ligne directrice de cette comité, c'est un prochain chapitre. Le comité a déjà organisé les discussions concernant le booster, le dose rappel cette semaine. Donc, j'ai assuré le ministre quand il m'a demandé quand est-ce que le comité consultatif va avoir de prochaines recommandations. Je lui ai dit cette semaine.
I said, well, it's happening this week.
C'est vraiment à temps. It's very timely.
So it's very timely.
When the minister asked me the question, you know, can NACI take another look at the booster dose recommendations? I said, well, NACI is actually meeting this week already to look at the next stage of the booster recommendations. So here we are. I thank the committee and everyone who worked on it in an expedient manner. But I think everyone's been looking forward to this recommendation.
Yep. It's Dr. New. I can maybe just add to what Dr. Tam has said. It's right. You know, the committee has been looking at this issue for quite some time, and it takes a while to analyze the data, looking at things such as, you know, the dose interval, what is the experience in Canada, the good level of protection we've had in the general population, and how it might be slowly diminishing, but maybe, as I said in French, maybe not at the same rate as in other countries that had that shorter dose interval. So that's all been taken into account. And now, as we said, I think it's a good time to make the recommendation, which NACI is doing today, with the booster doses, as we are now gathering insight with the winter. As lots of other things are happening, such that with the fact that we don't want to wait too long, because if we wait to get the actual data on, increasing hospitalizations and other lagging indicators, then it'll be too late, because, even with a vaccination program, it takes 2 weeks, for an individual who receives a vaccine to actually get the, maximum protection. And so all those factors have led to this moment, and it's not, just because of the Omicron. It's sort of, good timing as well, because it just highlights the importance of vaccination, but it's not because of the Omicron variant per se. Thanks.
Merci beaucoup pour les précisions.
Thank you very
Je vais
much
aussi revenir sur le délai de 6 mois. Je voulais juste savoir pourquoi le CCNI s'est basé exactement pour déterminer ce délai-là. Est-ce qu'il y a des études ou bref des données de certains pays en particulier sur lesquels on s'est basé là-dessus?
Which we use to come to that figure of 6 months.
OK, merci. C'est Dr. New. Je peux commencer peut-être aussi, Dr. Tunis et Dr. Tam pour ajouter. C'est vraiment, je pense, avec notre expérience ici au Canada, parce que nous autres, je pense qu'on est même comme des leaders pour montrer aux autres pays avec notre politique, nos programmes de déploiement de vaccins avec un intervalle plus long entre la première et deuxième dose de vaccin. On a montré on a même eu à l'échelle de la population une protection plus forte et aussi plus durable avec un intervalle plus long. Et c'est en analysant toutes les données probantes que le Comité consultatif national d'immunisation est arrivé avec une recommandation que c'est bon d'attendre au moins 6 mois, attendre même plus long, mais au moins 6 mois après l'achèvement d'une série primaire de vaccins pour avoir une dose de rappel. Parce que avec même les principes de vaccinologie, immunologie très bien établis, on voit que
immunology, which are well established,
robuste et plus durable avec un intervalle plus long. Donc, c'est pourquoi on a la recommandation pour les 6 mois. Mais je ne sais pas ce que Dr. Tounis ou Dr. Tam a quelque chose
Perhaps
à
Dr. Tam
ajouter.
and Dr. Tounis would like to
Oui,
complete the
merci.
answer.
Yeah, I can add some additional context also. So one thing to keep in mind is that the authorized intervals by the regulator are also 6 months after the second dose. So the majority of the evidence that has been generated around booster doses is looking at a 6-month interval. That was what was dominantly reviewed by Health Canada, the regulator, and also, of course, by NACI subsequently. Another thing to consider, as Dr. New was saying, is that we know that intervals do matter, and they do have an influence on the nature of the immune response, the durability, and the level of the immune response. So we've seen a trend with the primary series of the first and second dose, where longer intervals can support higher effectiveness, higher immune response, and more durability over time. And there are also early indications from some of the literature that a sufficiently long interval between the second dose and the booster dose also results in higher antibody levels. And it might be the case that actually shorter intervals between second dose and booster dose could have lower antibody levels. So that was certainly all considered by the committee, but I think it's reasonable to say that the largest body of evidence around booster doses is looking at this 6-month interval range. So NACI is always following the evidence and keeping track and looking if there are areas where they can actually try and optimize and deviate from whatever the main body is saying if necessary. But in this case, the largest volume is at 6 months. We're seeing these indications that that longer intervals support higher immune responses. So the committee was most comfortable with 6 or more months for that booster dose. Thank you.
Merci. Opérateur, prochaine question.
Thank you, operator. Next question.
Thank you, merci. The next question is from Abigail Biman from Global News. Please go ahead.
Hi, thanks for taking my question. I noted that there's a question in the report as to whether this third dose is actually a booster shot at all, or whether it will eventually be considered part of the primary series. I'm wondering if you can speak more about that and whether we have a better understanding of whether Canadians may be expected to get a shot every 6 months or at some other interval, consistently going forward.
Yes, this is Teresa Tam. I'll begin, and I'll look to Dr. Tounis just to supplement the answer. So I think there's a sort of subtlety to that question, and most members of the public don't necessarily understand additional doses for a primary series versus that of a booster. So because we're in the middle of a pandemic, a lot of the clinical trials were done with massive collaboration and as timely as they possibly can. So you don't actually have time to work out all of the different doses, different intervals, and look at what is the best regime for the primary series. So NACI, for example, has looked at the fact that an additional dose should be offered to those, for example, with underlying immune conditions, in terms of immunocompromised conditions, those who don't mount a good immune response, then an additional dose would be important. And that is considered part of the primary series. Whereas the booster dose is to help shore up and elevate that immune response after someone has had adequate, what we call priming of the immune system. And that's what we actually don't really know whether this third dose, for example, for some of these populations we talked about today, is truly a booster or part of what might in fact be a primary series. So it is a little bit complicated. But the bottom line is that if there is waning immunity over time, then an additional dose or boost to your immune system helps, at least in the short term, boost your antibody levels and increase the quality of your overall immune response and the durability of the response. But I think part of it is because we're doing clinical trials and observational studies as the pandemic is progressing. But Dr. Tounis, you have anything else to add?
Yeah, thank you. So I think Dr. Tam has really explained it quite well. And in the committee's analyses and in their advice to us, they've been acknowledging that this is an evolving story. And it sometimes takes years to disentangle the difference between the number of doses required to establish the most strong, well-established primary response versus that recall response or the booster where you're trying to then recall the response or augment it over time. And actually, historically, in other vaccine programs, I think it's worth noting, like for hepatitis or human papillomavirus, that the original authorized schedules did evolve over time, over years. As we learn more and there's, further study continues and we learn how to refine and optimize the schedule and the series, that's a fairly normal progression within vaccine programs. You start with what's available when the products are first authorized and the clinical trials are conducted. And then over time, we iterate, study, and evolve to try and optimize that schedule and that series and to really use the immune system to the greatest advantage. So I think that it's important that people are aware that we'll continue to see this schedule evolve, and the committee has advised us, on numerous occasions that it's going to continue to be dynamic and evolve over time as we learn more. Also, of course, as we do consider things potentially like variant-based boosters that might be taking the immune system in a different direction over time, the interaction between a primary series and booster doses or booster series is still very much under investigation. So it's I think it's an evolving story, and it's something that the committee is acutely aware of and keeping track of. But the important thing to remember out of today's advice is that third dose or booster dose is being strongly recommended for a large segment of the population, and then is being also recommended as maybe considered for really everyone 18 and over. So it's probably not important to get too hung up on the definition of the booster versus the primary series at this time, as we know that the situation is evolving.
Thank you. I also wanted to ask, I noticed in the literature released today, if I'm reading it correctly, it says that the risk of myocarditis after the booster is lower than after the second dose, but higher than after the first dose. I'm wondering if you can expand on that, and noting that there are a lot of people still hesitant about a shot for myocarditis, if you could just speak to, how rare it is or not overall.
Yeah, so I'm happy to respond to that. So what we've seen predominantly in terms of myocarditis rates and booster doses has been evidence out of Israel, where the booster program progressed very quickly. And generally, the third dose myocarditis rates have been in the range of around 0.5 per 100,000, which is lower than the rates that we've seen out of second doses, which is more in the range of 2.4 per 100,000. So several-fold lower than the second dose myocarditis rate. So it's generally understood that that those myocarditis rates for the third dose is sitting somewhere in between the first and second dose, but it does seem to be substantially lower than the second dose, which is great news. And so the committee's been very encouraged by that, and that's informing their booster advice, and they're very comfortable moving forward with these booster doses because we know the rates are showing to be lower.
Operator, next question, please.
La prochaine question de Louis Blouin, Radio-Canada. La parole est à vous.
Louis Blouin, Radio-Canada, over to you.
Oui, bonjour. La question est pour le
Good
docteur
morning. My
Nou. Qu'est-ce
question
que
is for
vous auriez à
Dr.
dire
Nu.
aux gens
What
qui
would you
hésitent
say
à
to
prendre tout de suite
people
leur prochaine
who are
dose parce
hesitating
qu'ils
to
veulent
take
attendre
the
pour le
next
prochain vaccin
dose
qui
because
sera
they're waiting
adapté
for the
au
next
variant
vaccine,
Omicron?
which will
Et
be
voyez-vous un
adapted to
scénario où le variant
Omicron? And do you
Omicron
see
pourrait
a
devenir
scenario
dominant?
where Omicron may become the dominant variant out there?
Merci pour la question. Je pense
Thank you for the
qu'on a
question.
a déjà souligné le point qu'actuellement, ici au Canada, le variant le dominant, c'est le variant Delta. Donc, je pense que c'est très important de souligner le point qu'avec le virus qui circule au Canada, ce n'est pas Omicron. C'est un nouveau variant. C'est important de prendre au sérieux pour étudier c'est quoi les implications pour la propagation. Mais à date, le variant préoccupant, c'est Delta. Et les vaccins, on utilise actuellement, sont très efficaces contre l'infection, mais aussi, plus important, contre les maladies graves. Donc, maintenant, les recommandations aujourd'hui pour une dose de rappel, c'est vraiment pour, comme on dit, augmenter le système immunitaire et donner une bonne protection contre la COVID-19 avec la situation qu'on a ici au Canada. C'est toujours, comme on dit, une possibilité au futur, à fur et à mesure. On peut adapter, peut-être, on a peut-être des autres vaccins, peut-être adaptés pour Omicron ou des autres variants, mais ça, c'est à l'avenir. Pour la situation actuellement, c'est très important de souligner le point. C'est pas une bonne idée d'attendre pour un autre vaccin plus tard parce que ça va prendre au moins quelques mois et la situation c'est important de faire face maintenant à la situation aujourd'hui. Donc, ça, c'est une question. Et pour la question pour quel variant, peut-être, est-ce que l'Omicron va être peut-être plus dominant? On ne sait pas. On voit peut-être en Afrique du Sud, dans quelques pays, oui, peut-être ça commence à être le variant préoccupant dominant. Mais c'est difficile à faire peut-être, comme dire, prendre la situation en Afrique et comparer ici au Canada parce qu'il y a beaucoup de différences des facteurs. On regarde toujours la structure, la démographique, la population, la couverture vaccinale. On voit aussi en Afrique du Sud que la couverture vaccinale, c'est plus faible qu'ici au Canada. Donc, il y a toutes sortes de facteurs. C'est aussi très important de regarder qu'est-ce qui se passe actuellement dans les autres pays en Europe, aux États-Unis et même ici au Canada. Donc, je pense que c'est quelque chose qu'on continue à suivre étroitement et on va s'adapter au fur et à mesure. Mais pour l'instant, pour aujourd'hui, c'est très important de souligner le point. Si vous faites partie d'une population prioritaire, c'est vraiment les personnes âgées de 50 ans et plus. C'est une bonne idée, c'est très important d'avoir peut-être le dose de rappel. Merci.
J'aimerais vous demander, pour votre instruction concernant les 12-29 ans, vous dites que c'est préférable pour ce groupe d'âge-là d'avoir le vaccin de Pfizer plutôt que Moderna. Ma question, est-ce que les gens qui ont reçu celui de Moderna doivent s'inquiéter? Qu'est-ce que vous suggérez aux provinces? À votre connaissance, est-ce qu'il y a toujours des provinces qui utilisent ce vaccin-là dans ce groupe d'âge-là? On devine bien oui, ce serait quoi votre message?
Oui, ce n'est pas le message pour moi personnellement aux provinces et territoires. Nous sommes tous des collègues, nos homologues des provinces et territoires. On continue d'avoir des bonnes conversations, discussions en analysant dans l'ensemble toutes les données probantes et aussi même les orientations, les recommandations de CCNI on fait la déclaration aujourd'hui. Donc, je pense que les personnes âgées de 12 à 29 ans, c'est vraiment avec beaucoup de prudence. C'est comme c'est subtil, une recommandation. OK, peut-être qu'on utilise, on recommande le vaccin de Pfizer, peut-être comparé à le vaccin de Moderna. Mais en fin de compte, il faut toujours souligner le point que les deux vaccins, ARNM, sont très efficaces. Ils sont les deux donnent un bon niveau de protection. Même, on peut dire que avec les données probantes, l'efficacité, même dans les études, peut-être l'efficacité réelle du vaccin moderne est peut-être même plus haut comparé au vaccin de Pfizer. Donc, je pense que pour peut-être les personnes plus âgées, les autres populations prioritaires, c'est peut-être une considération pour le déploiement des vaccins Moderna comparé à Pfizer. Pour les jeunes, si on a eu déjà un vaccin de Moderna, Moderna, je pense que ce n'est pas une question de s'inquiéter parce que si on a eu vraiment, comme dit, peut-être l'effet secondaire de myocardite, normalement, c'est comme la semaine après l'administration du vaccin. Donc, ce n'est pas de problème pour aujourd'hui, mais peut-être que pour avancer, pour une autre dose, on recommande, comme on a déjà déclaré aujourd'hui, que c'est une considération de regarder les risques et les bénéfices de vaccin Pfizer comparé à Moderna. Mais en fin de compte, on sait toujours que les provinces et territoires, avec leur propre programme de vaccination, ils ont tous les mêmes renseignements, informations, données probantes. Et c'est vraiment eux à prendre les décisions éclairées pour leur propre programme de vaccination.
Merci. Merci. Opérateur, a-t-on d'autres questions au téléphone?
Thank you, operator. Are there further questions?
Oui, nous avons d'autres questions. The next question is from Laura Osman from the Canadian Press. Please go ahead.
Hey there. Thanks for taking our questions today. I wanted to start by asking you about a line in the NACI report that said that issues of global equity were taken into account when deciding on these recommendations. There was not any elaboration on that point. So I'm wondering if Dr. Tunis, Dr. Tam, maybe you could speak a little bit to why it is that we're recommending we give boosters to healthy adults in Canada as opposed to shipping those doses to other countries where vaccine rates are at like 2%.
Maybe I'll start, and then Dr. Tunis might want to comment on how NACI deliberated on the equity issue. But NACI does not just take into account science and data, they take into account other considerations as well, which includes ethics and equity. All I can say is that we need to do both. We need to be able to protect our population in Canada, using the best available science and the vaccines that we have, as well as supporting other countries. I think we can do that. NACI, as you've seen, have been quite thoughtful. They didn't just rush out and say, everybody get a booster. They've been focusing on the science and focusing on the highest risk groups. So even today's recommendation has a strong recommendation focus on the 50 plus and those with other higher risk factors. And the younger populations wouldn't have the 6 months probably until the new year for the most part. So I do think that is a balance, and it is a balance of a thoughtful, methodical approach, as well as being able to recognize and take equity into account. Dr. Tunis, I know that NACI absolutely did think about this perspective. Would you want to elaborate?
Yes, yeah, thank you, Dr. Tam. It's been very central in many of their discussions, and they're very cognizant of the the request from World Health Organization to delay booster doses as long as possible, except for those at highest risk. And that's I do agree. I think that's what we're seeing in the advice today from the committee, an emphasis on those where the risk will be greatest and the need is greatest, and then also creating opportunities for others 18 to 49 years of age. And I think it's noteworthy that, as NACI has been continuing to monitor the evidence and to provide us this iterative advice on boosters, the last update being on October 29th, they have tried to acknowledge global vaccine equity as much as possible and really delay the use of boosters until the time when they're really perceived to be needed to get out ahead of potential outbreaks and expansions of disease in Canada. So they've been very central to a lot of the discussions, and I think that is exactly what we see reflected in the advice today.
Thank you so much. I also wanted to ask you, Dr. Tam, about something a little bit off topic on border screening for the Omicron variant. We know that the testing before and after arrival is really thorough. It's catching a lot of the incoming Omicron cases, as opposed to travel bans where, travel bans for select countries tends to be less effective, according to many experts. So what evidence is there to support doing both when testing is going to catch the vast majority of cases?
Thank you for that question. And we will also be discussing, I think, border measures later on in the day with Minister Duclos for one of the press conferences. I think what I would say is that, at the beginning, when things are evolving rapidly, layers of precaution are taken as fast as you can, because really you're trying to buy a bit more time and to delay the spread of the virus as much as you can. As time goes on, once we gain an understanding of where this virus is in the world, then some of those measures will need to be revisited. But I think that those were the fastest measures at the beginning. But we do need to reevaluate them. At the same time, of course, then fine-tuning and escalating some of our testing protocols at the border was done simultaneously as well. And that is also being ramped up in a phased approach according to an analysis of the global risk at this time. So I think both were being implemented as quickly as possible as a precautionary approach at the start. But we will need to re-examine that as we learn more about the virus.
Merci beaucoup. En théorie, on devrait terminer la conférence de presse autour de midi, donc on aurait le temps pour une autre question, mais si les réponses sont courtes, peut-être d'autres questions suivront. Opérateur.
Thank you, merci. The next question is from Cormac McSweeney from City News. Please go ahead.
Hi. I'm just looking for, again, a little bit of clarity on the age group. So provinces can, if they're able to, offer booster shots to people 18 years and up if they choose to, because they're not bound by NACI advice. However, priority should be given to people in the age groups 50 and up, as well as all the other at-risk groups that were mentioned earlier. Correct?
That is correct. And provinces will take into account their population and their demographics and the risk factors. But that what you've said is exactly it. I think everyone has been trying to focus on the groups at highest risk. And I hope that the NACI recommendation is very helpful to the provinces and territories. And I think begins to provide some guidance as to which age groups should receive the strongest focus. But it depends on your demographics, depends on your setting in terms of your health services and your ability to access other capacities of the healthcare system. So I think provinces have a tough job in trying to balance all those things. But I think I strongly support the NACI recommendations, and all of my colleagues, the chief medical officers, will also felt that the NACI recommendation was very helpful to them as we discussed them yesterday. So I think we should be able to see provinces roll out their booster campaigns, and please do go and get your booster in that sort of 6-month time interval. It should be in a fairly thoughtful and orderly manner according to their needs.
And just as a follow-up about the 12 to 18 age group and the 5 to 11 age group, so the younger age groups, is it just simply about timelines for when they were authorized to receive the initial series of doses as to why we're not hearing a little bit more about this? Or is there a medical reason that you're not, including boosters for them at this time?
Yes, we're not including boosters at this time because they've only just started their primary series in terms of the 5 to 11-year age group. And one vaccine is now authorized for use. Kids, go get vaccinated, and the parents, please support them. But it's too early, and I think NACI will continue to monitor the evolving vaccine effectiveness over time in that age group.
Yeah, and to add additionally to Dr. Tem's remarks, it's good to keep in mind that boosters for adults were studied in clinical trials also. So there's that dimension as well, that we actually have not seen evidence yet of boosters and for example, the safety profile in adolescents or in children. So that's something that NACI will be carefully watching. And if there is a need or an urgency based on declining effectiveness or something, then there's a possibility that they could provide advice in advance of clinical studies. But we don't see that coming at this time. I think, as Dr. Tem mentioned, it's way too early to be speculating about how that will go in the end, but we know that continued study will be important to inform any decisions about boosters in those groups.
Okay, good job, questioner and doctors. We have time for one last question over the phone.
Thank you. The next question is from Matt Ingram from THCH News. Please go ahead.
Thanks very much for taking my question. I'm wondering if any of the recommendations today, and specifically the 18 to 49 recommendation, was influenced at all by the emergence of the Omicron variant.
Yes, it's Teresa Tam. I'll take that question. So NACI has been making successive recommendations on boosters. They were already scheduled to have the discussions on this next set of recommendations, regardless of Omicron. But again, I thank them for being so diligent and fast that we got a recommendation from them, having the fact that they've reviewed all the data and in such an expedient manner. So it's not because of the Omicron, but I think it's also timely because we're watching the Omicron variant.
Thanks very much. As a follow-up, do you think you could give us an example of someone in the 18 to 49 age group? What kind of situation where it would be appropriate for someone like that to get a booster shot?
Yes, I'll start, and maybe Dr. Tunis will want to add. There's different circumstances, and some people in the younger age group may have received their vaccines earlier. For example, they may be health workers or others, so they may in fact have received the vaccine quite earlier on, and they will be scoped into the group where it is strongly recommended. There are other adults in that age group that may have underlying medical conditions, immunocompromising conditions as well, and those younger adults need to discuss it with their health providers as to whether they should get the boosters now. But for the most part, most of the healthy adults 18 to 29 or 30 to 49, the recommendation is you can certainly go and get your booster, wait 6 months.
Yeah, and to add a little bit more, what what the committee has communicated in their advice is, and you'd see this in the report, that there's a table outlining considerations for jurisdictions and also for individuals about the booster decisions. And so they do outline that the risk of increased waning of protection and or lower protection could be considered by the individual, the risk of severe illness from COVID-19, which could tie into some of those medical principles that Dr. Tam was mentioning, like underlying medical conditions, older age, also racialized and marginalized populations who have been disproportionately affected due to a number of intersecting equity factors. And then the committee also identifies the risk of transmission to individuals at increased risk of severe illness as an individual consideration around booster decisions. So if you're living with or in proximity to people who are at increased risk of severe disease, then that's another consideration. So I don't think there's a single patient or individual profile that can be really outlined, but they've set out these guiding principles that should be considered when factoring in that decision. Thanks.
Merci beaucoup tout le monde. C'est ce qui met fin, pardon, à cette conférence de presse. Mes excuses à ceux qui n'ont pas eu de questions.
Apologies to those who were unable to get their questions in. Thank you.
Thank you for your participation. Merci à tous les participants qui se sont joints.
COVID-19 vaccination programs. Today, NACI updated advice on COVID-19 mRNA vaccine booster doses, as well as recommendations on the use of mRNA COVID-19 vaccines in adult vaccine-associated myocarditis and/or pericarditis, most often seen in males aged 12 to 29 years. Regarding boosters, NACI considered emerging evidence on waning protection of vaccines over time and the safety of mRNA vaccine booster doses. The rare risk of myocarditis and/or pericarditis appears to be lower after the booster dose than after the second dose of the primary series, though it is higher than after the first dose. Based on this, NACI has increased the strength of their recommendations to now say a booster dose of an authorized mRNA COVID-19 vaccine with quality, snug-fitting mask, avoid crowding, and taking other measures as possible. Thank you. Merci. Megwich.
Bonjour, d'augmenter, mais il existe encore d'importantes variations régionales relativement à l'activité de la maladie. Au cours des 7 derniers jours, plus de 2800 nouveaux cas ont été signalés en moyenne chaque jour au Canada. À l'heure actuelle, les tendances des cas de maladies graves se sont stabilisées. La lutte contre les infections, les taux de vaccination et les autres aspects d'intervention des experts du Comité consultatif national de l'immunisation, ou CCNI, ont continué de mettre à jour des orientations pour renforcer un RNM contre la COVID-19 chez les adolescents et les jeunes adultes. Le Comité consultatif national de l'immunisation recommande et les autorités de la santé publique au Canada conviennent que la vaccination des personnes admissibles et qui n'ont pas encore reçu leur série primaire des vaccins doit continuer. Le vaccin qui touche principalement les adolescents et les jeunes adultes de sexe masculin âgés de 12 à 29 ans. En ce qui concerne les vaccins de rappel, le Comité consultatif national de l'immunisation a tenu compte des nouvelles données probantes sur les déclins de la protection des vaccins NNM autorisés contre la COVID-19 devraient être offerts 6 mois ou plus après avoir reçu une série primaire de vaccins contre la COVID-19 aux populations suivantes. Les personnes de 50 ans, les personnes qui ont reçu exclusivement une série de vaccins à vecteurs viraux contre la COVID-19, ce qui comprend seulement le vaccin